Hi, I'm Anup Kathuria. I'm a neonatologist and I work here at Chartres-Maybridge Hospital for Women and Newborns. This is the largest delivery hospital in California where we deliver over 8,500 babies a year. And one of the great things about working in this hospital, all the new therapies and new technologies that we're using to help give babies the best start in life. The majority of babies that we take care of are born up to 4 months early, and I'm going to show you an example of some of the technologies we use on these kinds of babies. Behind me here is a setup of a baby that is the exact size of a baby born over 4 months early, or around 24 weeks of age. And you can see the technologies that we use on infants like this. So over here are two of the therapies that we use. One of them is a light here, and this light actually helps get rid of bilirubin in babies, which is a naturally occurring substance, but at high levels can cross the brain and cause problems in terms of development. And this light here has a UV spectrum that allows the baby to get rid of the bilirubin actually through their skin. And we'll leave this light on for several days to help babies get rid of bilirubin to safe levels. The other great technology that you can see over here is this camera. This NICView camera allows parents to remotely view their baby from either on a different floor or even from afar. And it's important to realize that babies can spend up to 4 months with us here in the NICU, so being able to bond and be able to see your child is critical. So these are two really great technologies that we're using here today. So next to me is one of two twins that was born at 24 weeks gestation. Again, that's 16 weeks early, or 4 months, right at the end of the second trimester. These twins were born 5 days ago, and the boy right here next to me is actually on some special equipment that I'm going to walk you through. So if you come in here close, you can see that most babies they require a breathing tube at birth. But he actually is on a device known as CPAP, which gives him air through the nose into the lungs. So now, here's his sister, who's a little sicker than his brother. In fact, she's not receiving the therapy of oxygen through her nose, but actually has a breathing tube and is hooked up to a very specialized ventilator that delivers over 600 breaths every minute to this infant. And one of the things that the ventilator does is that because the breaths are so tiny, it minimizes any extra damage to her lungs if she's going to require this therapy for a long time. There are a number of therapies that we use in addition to the ones I've already described. One of them is called hydrotherapy, where we take babies that are still sometimes on respiratory support, needing oxygen to breathe, but we immerse them into a warm water bath, which creates the ability for that baby to move around as if they were still in the womb, to allow their joints to further develop, to build muscle strength and tone. So as a neonatologist, one of my primary roles are to attend high-risk deliveries. And these are going to be babies that are not going to be breathing well at birth. And one of those things requires the obstetrician to cut the cord where the baby's attached to the placenta and hand the babies off to doctors like myself. The problem with that is in that cord, as well as the placenta, are billions of stem cells and nutrient life-saving cells that help babies' brain, heart, and lung. And one of the research that we've been trying to do over the past several years are looking at the benefits of that cord blood given to babies who need it most. Well, one of the things that we've been able to develop are these wonderful new beds that allow the baby to remain attached to the mother. And the idea is to continue to develop this therapy across other hospitals. Currently, we're the only hospital in the country that's using this technology, but the hope is over the next several years, more and more of these beds will be available in every labor and delivery room to allow these babies to remain connected to their mother, both emotionally as well as physically, with these cords intact. So thank you for joining me on this virtual tour. I hope you were able to see a number of the examples of the therapies we're using for our little babies, as well as get an idea of the type of care we provide for our newborns. And it's really important for me to stress that none of this would be possible without our philanthropic partners, the families that gave their time and energy to help us deliver the best care for these newborns. And I hope you continue to partner with us over the upcoming years. Thank you so much.